Just a movie, just Hollywood. But fears maybe not just Hollywood. The threat some fear could be just a plane ride away from coming here if we're not careful. Welcome, everybody. I'm Neil Cavuto, and talk about scary stuff. So far, that's all they're doing, talking about it. 2 Americans in West Africa now diagnosed with the deadly Ebola virus. A third American dead after boarding an international flight from Liberia with no symptoms of the disease. He reportedly collapsed upon arrival in Nigeria, died a short time later. And now the Centers for Disease Control issuing an alert to hospitals in this country to be on the lookout just in case, out of an abundance of caution or an increasing abundance of worry. Before we get to our top doctors, to Greg Palcott in London with the very latest. Hey, Greg.
Neil, according to officials, it is a health nightmare of a global proportion. It is the largest outbreak of the Ebola disease in history. Over 1,200 cases, over 670 deaths. With no known cure, the fatality rate is as high as 90%. While so far it has been limited to countries in Western Africa, it has already touched Americans. As you noted, Patrick Sawyer, an American citizen born in Liberia, one of the countries affected, came down with Ebola after caring for his sister with the disease. He died last week traveling to Nigeria. Dr. Kent Brantley and Nancy Wrightbull, Americans who work with the charity Samaritan's Purse, are seriously ill with the disease. While Brantley wore protective gear while dealing with the patients, there are still concerns for his family. They are now back in Texas. They were with him a week before he was sick. They are now on 21-day fever watch. The disease is spread through contact with blood and other bodily fluids. Countries in that area which are affected are taking huge care to minimize that contact. They are screening travelers. They're shutting borders. They're educating a very worried population. And so is the United States. The White House saying that it is monitoring the outbreak. It is offering assistance. Crucially, Neil, the Centers for Disease Control now says that the risk of this deadly virus spreading is remote, as long as care is taken. Back to you.
Greg, thank you very much. Our physician, Dr. Josh Mugel, just back from Africa himself. He witnessed this Ebola outbreak firsthand, says he could come here if we're not being careful. His friend, one of those American victims. Doctor, good to have you with us on the phone. What do you know about this? What did you see when you were there?
Well, thanks for having me, Neil. I worked at JFK Hospital in Monrovia, Liberia, which is one of the central hospitals there. And I was not there to do Ebola work, but unfortunately the first case in the hospital came while I was there, and we witnessed basically a very sick person die in the hospital, and a very hard time of the staff preparing for it. So there's little preparation for it. And there's just a lot of fear in general in the city and a lot of fear in all of the hospitals that ended up taking care of these Ebola patients.
Now, when they locked down travel to and from Liberia, for example, I told that's not unprecedented. It doesn't usually last very, very long, but it was done at an abundance of caution.
Yeah.
They fear it's spreading. Do you?
I do, especially since we see the first case going to Lagos, and that was spread by air travel. So now we have it in 3 major metropolitan areas in Africa. We have it in the Sierra Leone capital. We have it in Monrovia, and now we have that first case in Lagos. So the fact that it's in major cities that have international airports, I think there is a lot of concern that this can spread internationally.
How does it spread, doctor?
So mostly through bodily fluids. The disease, unfortunately, causes a lot of bleeding. It causes nausea. It causes vomiting. It causes diarrhea. It causes excessive sweating. And so all of those things produce a lot of fluids. And so when people come into contact with those fluids, then they are at risk of catching it. So unfortunately, it's hitting a lot of healthcare workers as well, because they're the ones who end up dealing with the patients that have those fluids exposed.
But again, it's not an airborne. It's not an airborne type.
It is not an airborne, but it can be spread through, for example, droplets through like cough when you cough up sputum and stuff like that. So it is not airborne per se, but it can be spread through cough fluid.
And there is no cure.
There is no cure at this point, no.
Now, these other areas that have been affected, they are not shutting down their airports.
Yeah,
right?
I'm not. I don't know about the.
So I guess what worries me is I know they're not, because Liberia was the one that stood out. Maybe others have since, but that does worry me that travel is still allowed in and out of those other areas.
Sure.
Does that worry you?
And part of the concern, I think, too, is that symptoms from the disease can show up to 2 to 3 weeks after exposure. So somebody can be completely asymptomatic and board a flight. So even if they have screening processes in place, it's very possible that a person can get on a plane and then develop the symptoms of the disease and the transmissibility of the disease later on.
Now, you had a friend who witnessed endure this? Is it quick? What can you tell us about the process?
Well, unfortunately, I mean, it's a very lethal disease, and people tend to die very quickly from this. And part of that may be a fact that most of the people who have gotten this so far are in third world countries without a lot of without a lot of resources, and so they succumb pretty quickly to it. So I think most people end up who do die from this end up dying within the first 10 days or so.
Wow. Doctor, be safe yourself. Thank you very, very much.
Thank you very much for having me. I appreciate it.
Now to virologist Dr. Angela Rasmussen on how Americans can protect themselves. Doctor, if this is not something you get airborne, but what do you have to be on the watch for? What do we have to be just cautious doing?
Well, the CDC put out a press release today suggesting that emergency room doctors and first response health officials should be on the lookout for patients who have been traveling internationally, traveling to West Africa, who may be showing the early symptoms of Ebola. The thing that's somewhat frightening about the early symptoms of Ebola is that they look like a lot of other diseases. They look like the flu. They look like other diseases that are common in that part of West Africa, such as malaria and typhoid fever. So as long as physicians are aware, I think any cases where a patient is asymptomatic boarding a plane, gets off and comes down with Ebola might be isolated and diagnosed more quickly than if the doctors are not aware.
But it's possible people flying from Africa would exhibit no symptoms now. They might exhibit them later. So there's really nothing you can do to isolate them because there's nothing they're showing that would hint of them having it, right?
That's correct. The good news in that department is that patients are not particularly contagious until they do begin to show symptoms.
I see.
So again, early recognition of Ebola cases and isolation of them afterwards are critical to containing an outbreak outside of West Africa.
Now, we are not banning flights from Africa to this country. I think in the case of Liberia, we are, Doctor. Is that risky? Not that you would recommend air travel one way or the other, but should we be a little bit more vigilant tracking those coming from the African continent?
I think that will sort of depend on how many patients in the future are boarding planes and then coming down with Ebola virus. At the time, I believe that all of these major airports have now implemented a screening procedure where they're looking for patients who have a fever, who have potential early symptoms of Ebola, and erring on the side of caution are probably not letting anybody who has a fever board a plane at this time. So unless there are a significant number of additional cases, I wouldn't necessarily say that recommending that people avoid air travel is worthwhile.
Again, if you have the disease, you're not exhibiting any of the symptoms of the disease, so you're not dangerous just yet. The fact is you could still be carrying it in you, so you wouldn't be evidencing yourself for any of the symptoms of that to authorities at the scene when you board a plane, right? You could later, right?
Right. So I think, again, that's where ER physicians and first response healthcare workers are going to need to be educated to recognize Ebola, especially with people who have travel histories to that part of West Africa. The other thing that I think is being implemented is that screening should be occurring at destination airports for all flights originating in West Africa or connecting through West Africa.
Doctor, real quickly, who's more vulnerable to getting this if in the event it is passed along?
Do you mean in terms of professions or age?
Well, we know we always hear like the elderly or the feeble, or does it vary?
Certainly. I think in this, so far in the Ebola outbreaks that have occurred, and in this one in particular, really nobody is immune to Ebola virus. So it's not the elderly versus young, healthy people. Everybody can contract Ebola virus, and it's a highly lethal disease. That said, people who are seeking medical care early may have a better shot at receiving supportive care that can mitigate the ultimate lethal outcome of the disease. So essentially, if you think you have Ebola, get to a doctor soon so that they can take care of you and you might just survive.
Really? Okay. Doctor, thank you very much.
Thank you.